So the early symptoms of lung cancer, unfortunately, are not specific for lung cancer. So that's one of the difficulties, particularly primary care clinicians have in diagnosing early lung cancer. Cough is probably one of the commonest early signs, but as any GP will know, they have lots and lots of patients who present with cough, and very, very few of those will turn out to have lung cancer. So cough of more than 3 weeks duration helps narrow down the numbers a little bit, and then looking to see whether the cough is associated with any other risk factors. Smoking obviously is a risk factor, and cough associated with other symptoms such as weight loss, anorexia, chest pain, hemoptysis would all raise high clinical suspicion of lung cancer. Unfortunately, when patients present with those other symptoms, the lung cancer is often at a much later stage. So it's a very difficult situation for a primary care clinician to be in. And I think if in doubt, my advice would be refer. The symptoms of lung cancer at an early stage don't differ very much from those of other chronic respiratory conditions, and that's another problem. They're not specific. Cough could occur in many different patients, and even hemoptysis, which is one of the high red flag type symptoms for lung cancer, can occur in other conditions as well. But it should always be taken very seriously, because when it occurs, even if it's in another condition, it's likely to be a serious condition. So, for example, in some parts of London, TB is very prevalent, both in West, South and East London, and that could be the cause of hemoptysis in some patients, but that is something that also should be flagged up. So a chest X-ray early on in a patient with those kind of symptoms should be performed by primary care. So if a GP suspects lung cancer, the general feeling is that they should refer. Sometimes an individual may lack some confidence as to whether the referral is appropriate or not. So there are screening tools that can be used, like the Hamilton Risk Assessment tool, which will help give confidence to a clinician if they're unsure as to whether to refer or not. But high-risk symptoms, the red flag symptoms, weight loss, anorexia accompanied by hemoptysis, in a smoker, chest pain, are all things which should result in a referral for the patient. If you then combine that with examination of the patient, there may be other clues that will suggest that cancer is a likely diagnosis. Certainly patients who have evidence clinically of advanced cancer should be referred immediately to hospital. So, for example, superior vena cava obstruction. GPs, if they need advice or support to discuss a case with possible lung cancer, should get in touch with a lung cancer lead in their hospital. If for any reason it's difficult in finding out who the lung cancer lead is, because not all hospital websites have that clearly defined, then a call through to the respiratory department in that hospital or the respiratory registrar would be helpful. It's probably on the whole best to refer to the respiratory department. There is evidence to show that referrals to a respiratory department are dealt with more quickly and more efficiently than referrals to other departments such as A&E or general medicine or even to one of the surgical departments. Unfortunately, in the UK, deaths from lung cancer exceed deaths from any other form of cancer. And the main reason for that is late presentation and late diagnosis of the cancer. Partly because patients often don't recognise the symptoms as warning symptoms of cancer, partly because I'm afraid when they do present at primary care, they're often dismissed as low risk for having lung cancer, and partly because on occasions there have been delays in referral to hospital or activity within hospital, or that's much less the case now we have the 2-week wait work stream. So survival rates for patients with advanced stage 4 lung cancer are less than 5% in 5 years, and that's with treatment, chemotherapy, radiotherapy. Survival rates for early stage lung cancer are between 50 and 70%, so much, much higher. So early detection is absolutely critical if we're going to do anything about the mortality from lung cancer in the UK. It's an issue for London because lung cancer rates in parts of London are higher than they are in the rest of England. So for example, if we look at East London, the smoking prevalence rates are higher than they are for the rest of England, and the mortality from lung cancer is higher. We know that lung cancer is also associated with deprivation, and some of the boroughs in London, both West and East London, are the highest deprived in the country. So it's a big issue for people living in those areas.